Picture a world where female athletes can dominate the field just as confidently as men. This is what we're trying to achieve, where ACL injury prevention programs help unleash the full potential of every female soccer player. The issue is, female athletes are 4 times more likely to experience an ACL tear than their male counterparts. Why is this known as the biggest epidemic in the orthopedic world? Good morning, my name is Ethan Wu, and to what extent should ACL injury prevention techniques be used on female soccer players in the 21st century to optimize efficiency? This can be applied to various other sports that females participate in, such as basketball, volleyball, lacrosse, and even tennis. Provided by the College Board Stimulus, Thompson's article about Simone Biles states that sports are displays of human resolve being tested by circumstances. We all want to see athletes reach their maximum potential. Let's not let an injury so common in female athletes to get in the way. After extensive research, I have concluded that the use of ACL injury prevention training programs for female athletes need to be implemented more compared to men, despite various challenges, to enhance the safety and performance of the player. So, how does an ACL injury even work? The anterior cruciate ligament, or the ACL, lies directly in the middle of the knee. ACL tears can occur from quick pivotal stops or directional changes that overextend the knee joint. There are 2 types of ACL tears that can occur: non-contact and contact. In soccer specifically, contact tears can occur when an outside force meets the knee, such as a cleat to the knee. In non-contact tears, simply walking, running, or landing after a jump can trigger an injury. According to orthopedic surgeon Dr. Vonda Wright, females on average have wider hips, which causes the knee to turn inwards upon landing. Males have a wider stance and a more stable base, which is why these injuries don't occur as often. As shown in this diagram, the angle from the endmost point of the hip to the middle of the patella creates the Q angle, or the quadricep angle. On average, women have a larger Q angle than men, and a larger Q angle has a greater effect on the pelvic tilt. Multiple researchers have found that there is a correlation between Q angle and ACL tears. Douglas Bowers explains this by saying that the hyperpronation of the foot causes the tibia to turn inwards, and that the angle of the tibia has an effect on the rate of injury. Scientists have speculated that hormones and the female menstrual cycle have a slight effect on the rate of injury. During the menstrual cycle, hormones are constantly fluctuating, causing laxity within the joints. Laxity is how loose something is. So for example, the ligaments and tendons are not as stiff and are too flexible to handle a lot of pressure. Researcher Shigawa Mayu found that the menstrual cycle may have a substantial influence on anterior knee laxity. Artificial grass, better known as turf, is a major cause for ACL tears. If the body moves one way and the leg is stuck in the ground, then a tear is bound to happen. To prove this, researcher Michelle Xiao did a meta-analysis on the incident rates on artificial turf versus natural grass. The results were very alarming because female athletes on artificial turf shown that it was a 1.18 times higher than on natural grass. All the evidence listed here have led to solutions that already exist. For example, a current solution is neuromuscular training. Performing multiple tasks at once enhances brain and muscle connectivity. Training for this exists, and it can be a great preventative measure to prevent ACL tears. This illustration shown here shows a participant performing a double-legged squat while interacting with multiple neuromuscular stimuli. A player's mind is trying to focus on a whole bunch of things happening at the same time during practice and in games. So using this program helps enhance coordination of landing mechanics and overall decreases the risk of injury. Finally, kettlebell training can activate the hamstring and other supporting muscles. Nothing can be done to strengthen the ACL or the knee itself specifically, but surrounding muscles can. These include the glute, core, and quads. If there is an imbalance of strength, then it can lead to more injuries. What is the professional point of view? Professional soccer player Megan Rapinoe believes that female athletes are not receiving enough resources they need to perform at their maximum level. Dr. Christopher Jones and Dr. Vonda Wright agree and believe that women definitely need better resources at the team level to try and dedicate to injury prevention programs. The epidemic here is that ACL injuries are multifactorial and researchers cannot pinpoint the main leading cause. It could be a combination of a whole bunch of things occurring at the same time and we wouldn't know. After all that's been discussed, I have two final solutions. The first is that coaches need to be aware and train female soccer players differently than their male counterparts. And it's about understanding the limits of their players. The drills that coaches use are designed for men and weren't created to fit the female range. I'm not saying that females can't participate in these drills, I just think they should be altered slightly. Overtraining or overworking on the knees can wear and tear and cause issues immediately or in the future. Secondly, programs need to be followed and used more because statistics show that there is an 88% reduction rate for injuries. This leads me to my limitations. Female athletes being trained differently than males does not mean that females are weaker. This can be damaging to gender equality in sports and may fail to isolate gender-specific trainings. The implementation of programs are limited because the differences in motivation and commitment are difficult to implement globally. This topic is really important to me because my sister tore her ACL a few weeks ago, and it makes me wonder, why should a young female athlete's dreams be shattered when it could have been prevented? Thank you.
All right, two questions for Ethan. First up, what evidence did you gather that you didn't use, and why didn't you use it?
I gathered evidence about doctors and their implementations and their ideas, and some of them were out of the ordinary and it didn't really connect to what I wanted. And yeah.
Okay. And what advice would you have for other people that want to present or consider this a topic in the future?
I want to say that for researchers to use evidence from doctors, and because this is their specialty, they are interested in the topic and they specialize in this topic. They have a better understanding than the average person, and going to them looking for interviews or videos is really helpful.